You are welcome once again. So today we'll be looking at validity and reliability. You know that it's a common. These are common words. These are common words we encounter in our research life. And validity, by way of introduction, validity means the success of a method, improving and or assessing what is said to prove or assess. When we talk about method, it may mean even instrument, you use physical instrument as per to weigh, for weighing, for height. Also, it may mean tool as per questionnaire. So even it can even mean the whole of research. It's a method. For example, in the research study, you may employ quantitative method or qualitative method. So it's the word method, is very broad. It's applicable to a wide range of concepts. So the method can be even a particular scale to measure maybe blood pressure, even weight, or questionnaire to assess a particular thing. And in social science and in psychology and psychiatry, hardly do they use anything physical because most of the issues are conceptual. And that's why we'll be talking about something like construct. What does it mean? Because most of the things they measure at that level, they are construct, they are latent variable. So when we talk about method now, it cut across. So the ability or the success or the degree to which this method is able to assess what it's said to assess. So I can stand on the weighing scale now, and you tell me that my weight is, the weighing scale just read 120. Well, maybe it's not my weight, it's the way you measuring. I'm not 120. Maybe it's measuring my systolic blood pressure. Or you say the thing is 80. Maybe it's measuring my diastolic blood pressure. It may not be measuring my, and whereas it's for weighing, to weigh to measure my weight in kilograms. But if you give, it may be measuring something else. It will give you value. So that shows that if it's not actually measuring my weight, it's not valid. And if another person stands on it also, it will do the same thing for that person. That shows that that particular weighing scale is not valid. That's just a simple one. Maybe an instrument, maybe, those people that have used psychometric instrument to measure if somebody has depression. So by the time you ask questions, series of questions, how many times do you smile? How many times you contemplate committing suicide? Or have you ever gone for recreation? Or do you have friends that you confide in? All those things, when they ask you all sorts of questions, at the end of the day, they come and say, oh, this person has bipolar depression. It's possible the thing may not actually mention bipolar depression. So it means that the person that the instrument has bipolar depression may not have it. Or maybe even if the person has it, may not be to the extent to which the instrument has recorded that the person has it. So in that case, it's not valid. You want to measure depression, but it's measuring something else. So that instrument is not valid. It can be a whole method. You can even finish a research and you now conclude that this, and it may not be valid. That is what you have just, the whole conclusion may not be valid. And that one is very, very common. Sometimes if people don't even understand, can make totally wrong conclusion. So the word validity applies to a range of concepts. So if a method is valid, then the difference in the result between individuals or groups can be taken as representing the true differences. That is, if the method is valid, if you say I weigh 70 and another person weigh 80, so, this person is way more than me by 10. If the instrument is actually valid, we can actually say, oh, the difference between our weight is 10. You can say, oh, it's true, it is 10 because the instrument used is valid. It's the same thing, even the whole research. You say, oh, we have found out that average weight of women maybe is more than men in a particular community. So averagely. So if your method is valid, you can actually say, okay, women weigh more and averagely maybe by 5 kg is only, so we can actually say that is the true difference if we can be sure that the method you have used is valid. Now, and the method you have used may not only actually mean only the weighing scale. The weighing scale is on its own. The weighing scale used, but the totality of the method, because it's not only just weighing scale. You know, we have a lot of even stringent measure you put in. You know, the other time we talk about random error, talk about many different type of error. So there are some of them are due to the method you use, how stringent you are while carrying out those procedures. So it's not even apart from the weighing scale, even the method, the way you run your analysis, you may find out that maybe rather than saying that women weigh more, men may even weigh more, or maybe the difference between them is not significant. It's not much, and you now turn out to say, oh, it's much. So if that method is not valid, you can't actually say that the difference you have found is too different. If it's valid, so it's two different women weigh more by averagely by this amount. So reliability refers to the consistency of data stemming from the use of a particular research method or instrument. You know, the reliability, both of them also just the way validity cut across, but reliability also cut across, but not as wide as validity. Yes, because this one tends to move towards capturing of data, capturing. That is immediate talking about how you are able to take your measurement. So reliability is more towards the method you use to capture the take your measurement. Why validity is wide, it involves that also, but it's actually wider. You know, you can talk about the whole study is not valid. So the whole study can be a method, it's not valid. So reliability now talk about consistency. So the next slide will show us like a infographics that will give us mental picture how to differentiate between the two and how they are somehow related. So you will see, look at the first picture here. Try to look at the interaction of the validity and reliability. So this one is just showing a ball. Maybe somebody shooting a dart ball, shooting arrow. You see this first one, there's lack of validity and reliability. The target is the purple area, that is the center. But the person is throwing is not actually hitting. The person from the far of throwing the arrow is actually targeting the purple area, the center. But none of the arrow hits the center. That should it's not valid, because if you can hit the center, you can say, oh, it's valid. But none of them hit the center. Then, apart from the fact that none of them hit the center, they don't actually hit the same place consistently. If let's say, even though the way they didn't hit the center, you look at the second one, it's able to hit a particular place consistently. Of course, it's not valid, but it's reliable in the sense that if he's trying to go, he's going towards one direction many a time. It's consistent. So consistency, so reliability has to do with consistency, while validity has to do with measuring what you intend to measure. So this person intend to shoot the center, but it's not shooting the center, but it's shooting the periphery, and it's actually shooting a particular play consistently. So it's reliable, but it's not valid. So it's possible a method can be reliable, but it's not actually measuring what you have said that is measured. Maybe no, that one, maybe there's a premisconception or misconception from ab initio. Maybe that particular method is not actually measuring what you see is measuring, maybe measuring something else, but it's consistent in measuring what is measuring. But it's not measuring what you intend to measure. It's measuring something else. But it's consistent, because consistent means that if you do it many times, either you do it repeatedly, it's giving similar result, or I do it, another person do it, it's still the same thing. If I do it, I'm doing a study, another person is doing it in America, another person is doing it in India, you are getting the same thing. That shows that it's reliable, it's consistent. You are getting the same result, applying the same method. You are getting the same result. That is reliable. But it may not be measuring what you say is measuring. In that case, not valid. So you see, the first one is not neither valid nor reliable. So it's not valid, it's not reliable. But the second one is valid. It's not valid, but it's reliable. The third, can you see? Is eating the center. That's where it's supposed to eat. It's valid, and it is consistently. That shows that it is reliable. It is reliable and it's valid. If you look at the diagram down, the one down, also the red one, is the same thing. If you look at it, it's actually the same thing. The first one is neither valid nor reliable because it's not eating the center and it's not eating one place. And the second one is reliable, not valid. It's not eating the center, but it's eating a particular place consistently. And the last one is valid. So they're actually showing the same thing. It's only that the first one is showing that somebody is throwing arrow. Now, there's an issue here, and that is why I put this, the picture on the right side of this slide. Some people, sometimes in trying to find, if you try to do a lot of literature search to find out what reliability and validity mean and the relationship between them, you will probably see a fourth example here that will say not valid, not reliable, not reliable but valid. You know what we have here is that we have not valid but reliable. We have not reliable, not valid. Yes, we have valid, reliable, but we also have reliable, not valid. But you probably see the fourth one that it is not reliable but valid. That is a bone of contention. And you will see, look at this example here. You see, neither valid nor reliable, the first one. The second one, reliable but not valid, consistent with the second one here also. But you see the last one say valid and reliable, which is consistent with the third one here. But this third one here, I say fairly valid but not very reliable. So why I put it here, that you see some outrightly they will say valid but not reliable. But why I decided to put this one is that you can, fairly valid but not very reliable. See, you see the first statement here, a test can be reliable but not valid. But a test cannot be valid without first being reliable. So you see, reliability is a necessary condition, but not sufficient for validity. So a test cannot be valid if it's not reliable. For example, now, look at this. If something, let's say you are throwing a dart, and maybe some of the time, few of the time, it just hits the center. Yes, you say it hits the center, is valid, but when you send the most of it hit outside. So yes, you sometimes hit the center, but it's not consistent. So that's why if I do something seem to measure what it's supposed to measure, if another person does it or carry out it may not measure it. So you cannot say it's valid if something is not consistent, because it's now become 50-50 gambling. Sometimes it can be valid, sometimes it may not be valid. So it becomes gambling. So that concept is not good enough for scientific reasoning. So that is why it is not. So if you try to search literature, you see some people talk about valid, not reliability. You see where some people say that a test can never be valid unless it's first of all reliable. And that is where I stand. So it's not, you cannot say something is valid unless it's first of all reliable. But for the fact that it's reliable, it's not sufficient for it to be valid. Just like the second example we have there. It can be reliable, but it's not valid. But for it to be valid, it has to be reliable. Because if it's eating the center now, it's not eating it consistently, also eat outside. You cannot say it's valid. So there must be reliability for validity to be present. The reliability is not sufficient for validity. I think that one is very clear. Now, you see some related, I just try to related terms. Though there are many other related terms, we manage them, and later in our subsequent lecture, we talk about many things. There are many things that are related. You see something like standard error of measurement, you see something like agreement, many things are actually related to reliability and validity. But there's what we call practicality, economy of time, effort, and money in testing. So is it practicable? Something can be valid, reliable, but it's not practicable in this, especially in a certain context. And that is what we usually have in our environment. There are some things that are valid and reliable, but it's not practicable in our environment. You know, you don't want to deceive yourself. In terms of this expensive, the time, effort, and money. So there are some things that are like that. So this one just telling you, is it easy to design, easy to administer, and easy to interpret? Because sometimes you may not have much time, you may not have enough time, enough money, enough resources, enough expertise also, you know, to use a particular. Now, we call something backwash effect. That one just talk about influence of testing on teaching and learning. That one is more of academic now. So influence on teaching and learning. A method, sometimes how does it influence the people's learning? Sometimes you may use a method, people may find difficult understanding, you know, in that case, if people find difficult, maybe it's actually maybe related to the practicality also, find difficult, it may not, it may be possible for you to now make use of it or become expert in it. So if that is backwash effect. But there are some things that are, you know, they are easy, they are scientifically sound, then they are acceptable, socially acceptable. If you remember the description of primary health care, something that must be scientifically sound and socially acceptable. I think backwash effect has something related to that. Now, let's quickly look at the way we approach to measuring validity. You know, sometimes they call it type of validity. We rather call it approach. You know, because if you say type of validity, you may have to now define it based on a criterion rather, and define another way based on another criterion. We may have different criteria. At least if you look at the slide now, as we explain, you see like maybe two criteria, major criteria for for describing it. There's some people call it type, but it doesn't matter either you call it type or you call it approach. I try to put it here also in a pictorial form, at least in a flow chart. Now, how do we've already known that validity is to ensure, method of ensuring that what a method or instrument tend to assess or measure is able to measure it. That is the extent to which it's able to measure it. That is validity. How do we assess? And that one also can talk about the type. How do we assess it? The approach to it. Now, you can see four major here, 1, 2, 3, 4. And these 4 major approaches also, you see some of them are broken down into 2, 2. Even the first 2, somebody is making them. Please mount yourself. The first 2 can be collapsed into 1 also, as you are going to see. Phase validity. When talking about phase validity, though the description is on another slide, we have content validity. Let me just list them. So the next slide will now talk about how to measure, how to assess them. Phase validity and what they actually mean. Content, criteria, which can be divided into concurrent and predictive. We also have construct. We talk about what construct, and convergent and discriminant validity. And if you look at the type here in the chart here, you see the phase validity and content validity come to translational validity. Translational validity, as the name implies, somebody translating, somebody a little bit subjective. You're like somebody, if I'm speaking Greek now, somebody is translating. So what you get, if you cannot, maybe, yes, I'm speaking Greek, you don't understand Greek, you understand English, somebody is translating to English. So we cannot be 100% sure that what I'm communicating is what I'm saying is what you are getting. So the extent to which you are getting it depends on the translator. So the same thing when I say translational validity, the phase and content validity. Some people collaborate the two into what they call translational validity. I call the criterion related validity or just criterion validity is predictive and concurrent. We're going to differentiate between them. Then construct, convergent, and discriminant. So sometimes you may approach to validity may be in context of time and sample or context generally. When you are looking at whether the finding in your study is like this one, and you are looking at the whole study generally, the finding, is it valid for the setting? Is it true is it measuring what it's supposed to measure? Like for example now, if you have a sample, you did a research, maybe let's say experimental research, those people that were involved in the experimental research, the measurement, your conclusion, your finding, is it actually true? Because you can carry out a study, you can give us the different things. Because we already know that there are a lot of things that can cause you to conclude otherwise. There may be bias, systematic error may be there, and some other things. So you may conclude wrongly. The extent to which your finding is true for even those people that are involved in the study. You may say the mean hemoglobin concentration for a group of people is this, and it may not be true. So where you get it wrong, nobody knows. Maybe where they are doing it in the lab, or where you are doing your analysis or whatever. When you calculate the measure of central tendency, you can mix it up. You can give us mean and standard deviation, and what you are giving us may not be true. So if the finding is it true for that particular setting, that is internal validity. If it is true for that, not only that set itself, even you can extend it to the population. I mean, the population outside. That's external validity. And that one is just like, most of the time when we quote, say, oh, a study done by so professor so et al. And they found out that market women in north-central Nigeria are more likely to have average of 2 shops in the market at a time. It's a market women. And this person, they just sample, in fact, we say central, north-central Nigeria. So we have 6 states that are under that are categorized as north-central, from Kwara to Niger to Kogi to Benue, Nasarawa, and Plateau. These are not central. And somebody just maybe selected 2 states. Maybe selected Kogi and Plateau by random sampling or whatever it is. And from there, he selected some market in those 2. So not only even the market. At the end of the day, he studied maybe 600 in all. and now concluding not central. So the finding being valid for even those 600, that is internal validity. Those 600 people even study. Is the finding true for them? That is internal validity. Is it true to extrapolate as to say that you can just extrapolate? Is it true for all the market women in North Central Nigeria? That is external validity. It has a population validity. So can you even extend it to Ghana? Now say, okay, one work was done among women in Africa. Now you are not extending it to Ghana because you believe that somehow when you look at, we are all Africa. Believe what is true in Nigeria among market women in Nigeria can be true in Kenya or this. That is ecological validity, and both of them, both population and ecological validity, the example of external validity. So you can differentiate now. So the finding being true for the people, the immediate research setting, the participant in the research setting is internal. Then extend it to those people outside the setting is external validity. Can you see? It's a different approach. So that one look globally at the whole as a study. But when we talk about all these phase, content, criteria, construct, they look more at the instrument level, the two. Of course, whatever happened to the instrument will affect the whole study anyway. But the measurement is looked at that level of the instrument. While when we talk about the external, internal, we're looking at work globally. Now, let's quickly look at all these things I'm saying now. They are on the table for us to see the type of validity we just look at, then what they actually mean, and how do we establish them. And how do we establish them is also what we'll be doing in our workshop. The workshop we'll be having, we'll actually have hands-on on how to establish practical example, and we establish them. Phase validity. It measures how well the item can be seen to have a common thread. So if you have an instrument, most of the time now, when you talk about items here, just look at the instrument 2, questionnaire. Let's call it questionnaire. When we talk about questionnaire, the 2 you are talking about may be part of the questionnaire. And that's why I usually use the word 2 rather than bed. It's part of the questionnaire, because when you have your own, you design your questionnaire, we have the social demographic aspects, general information. Then that particular 2 you want to use is a section. So a measure of how the item in that 2 seem to have a common relevant term. If everybody say you are measuring quality of life, so all those questions should be pointing at quality of life. Not that they should have a common term. Those are the questions that, it's just like somebody asking question. As you ask 2 questions, 3 questions, that's physics question you're asking. Because if you're asking about 10 questions, all of them are going to physics, you know that one is not general knowledge. When you say you want to do general knowledge, you move around. But if you now focus on one area, you know that this is physics. So this question, are they pointing at a particular rather than general? Are they pointing at a particular thing? If you say you are measuring quality of life, all the questions, are they pointing towards quality of life? That particular people that want to measure, maybe there are many things adherent to anti-tuberculosis drug, adherent to antiretroviral drug, adherent to antihypertensive medication. So the question, are they pointing towards that adherent to that antihypertensive medication? That is it. And how do you is expert? You just give to expert. If I go, yes. These are questions on hypertensive medication. The one that is not there, remove it. So that is how to do phase validity. So if you remember, I talked about phase validity and content validity as example of translation, translation or translational validity, and translation validity. Some people group it as group them as translation validity. So it depends on the expert to do the translation anyway. So the second one is content. It's a measure of how well the item represents the entire universe of the item. They are related, but it's a little bit different from face. Face just look at, okay, these items, are they pointing towards the same thing, or there are some that are not saying this thing, which you know. Then the content, when you look at the objective, the scope of the study, that instrument, has it cover all? Because it's possible that yes, there is face validity, all the instrument, the items are related to the feed, but it may not cover all. That is what the content validity will do. It's the same expert. So you give it to expert to see, okay, those people that are experienced in that field to say, okay, all the different area have been. It can be a panel also. It can be a panel that look at it together and see that it cover all the different aspects, especially the objective. Because if you have a study, you have objective scope of the objective. Now we are through with the translation validity and the two of them. Then let's look at criterion. What does it mean? It relates to agreement between measure and another measure, which is accepted as valid, defined as gold standard. You know, we are all familiar with this. Whenever you want to validate instrument or anything, any method, you get to have a criterion, something that measures the criterion itself as the gold standard. That measure the criteria, that is serve as the measure of the criterion. Like for example, now, if you want to validate pap smear, the method for detecting early detection of cervical cancer, at the precancerous stage, gold standard is biopsy. So the criterion there is the finding of the biopsy. Whatever the biopsy says, anybody the biopsy say has cancer, or has whatever change in the cell, or anybody the cancer say abnormal cell. Okay, let me call it like that. Has abnormal cell. So in that case now, biopsy will be the gold standard. Then pap smear will be the test, what you want to validate. So when you compare, do they agree? Is it the same thing? You want to see how close are the two results. So in this case now, you are validating pap smear when you are comparing it, the result, because you're going to administer, all the people that will be involved in the study will do both pap smear and biopsy. That's the only way you can validate. You do biopsy for all of them, and now compare the result globally all together. How many of the people that biopsy say abnormal cell, pap smear say has? How many of you biopsy say they do have normal cell, pap smear says have normal cell? That is, it's not only I'm talking that one is talking about something that is more physical. But let's talk about other things like it can be even the questionnaire we're talking of. We are measuring, it may be a tool. The tool used to measure pain. And some people talk about ankle kinikon, different measuring tools to assess a particular thing. So you want to compare one instrument with one that is already established. There are reasons for doing that. In some situations, the one that is already established, it may not be true. It may be difficult to do that in our own setting, in a particular setting. The source, we talk about practicability, it may not be too practicable. The practicability may not be, maybe an issue in a particular setting. You now have an alternative that is more practicable, but of course, you want to use that one that is not more practicable, but that is the result that people know that is actually measuring it. So it will serve as the gold standard. You now compare the two. So there are two kinds of criterion. validity, concurrent and predictive. So in concurrent, as the name implies, in concurrent, when you say something concurrent, at the same time, pari passu. For example now, the issue of pap smear and biopsy is a form of concurrent validity because it is at the same time you take pap smear, you take biopsy from the person, you compare your results. It's very clear. Or if it is two instruments, you administer the two instruments at the same time, both the gold standard and the one you want to validate at the same time. And you bring the result because all of them have to apply. You have to apply the two to all the people, all the participants. So that is concurrent. But there are some situations that what you actually want to predict, what you want to validate, the gold standard, what serves as the gold standard, is not available. You cannot access it at the same time as the what you are measuring. So you can only predict whatever you get from the instrument you want to validate is predictive. It cannot just predict the real criteria. For example, why do you do jump now or do exam, final exam in secondary school? It will be sure that well, one of them may not be the only one. One of them is to be sure that pass through, they are well able to go for advanced degree, to go to higher institution. So that is just it. So if somebody now, if you want to validate the JAM exam, you can only predict those people that score very high. So let's see, after they have gone to school, in their first year or second year, or whatever, what is their performance, their GPA? So do the GPA correlate with the JAM score? Can you see now it's not the same time because when they did the JAM, it's going to be in future before the GPA, their performance in the university, which you are, because you are actually, it is believed that the person that have higher score is better. And in fact, to the extent that you admit them into some courses you feel are more difficult. But at the end of the day, you may discover that to actually say that the JAM score is actually testing what they say is testing, you have to do the validity, and the criteria will be their GPA. The same time also, the GPA also and the performance in real life. Someone that have A1, then you see A1 first class, second class upper. In the industry where they are, who is more innovative, are they more innovative? So is predictive validity to really validate, particular the GPA, the system in ISS to really know that they actually accessing the performance of these people, the student, they claim they are assessing. So it is when they go out, they are working, you try to find out. You discover that the data, collecting data now is going to be at 2 stages. For you to validate now, by the time somebody is working, you can collect the data of their performance and now go back to get the data of their GPA to see if those ones who are scoring higher in school are doing better in real life. That is predictive validity. I think you can differentiate between concurrent and predictive. Both of them have the gold standard bet. Is the time. Concurrent is at the same time. Can measure both the gold standard and what you are validating. Let's quickly look at construct. A construct is a latent variable. When they say latent is hidden, you can only represent them by what you feel are related to them, like happiness. Who has seen happiness? Who has seen happiness? But if people want to measure happiness, then I say, okay, if he doesn't have problem with his spouse, if he's doing well, he's happy, uh, he has good relationship with friend, he has friend, with family, say he's happy. So he doesn't have problem, he's not in debt, he's satisfied. So happiness is a construct. It's a latent, it's hidden. When you say latent, hidden, something that is hidden. You cannot physically. It's not like tuberculosis that somebody is coughing, you know that he has disease, or it's not like any physical thing. Oh, somebody is fat, he's obese, or somebody is slim, has lost weight. No, you know, so all the blood sugar, which you can measure objectively. So I don't know who can anybody that can measure happiness or quality of life. It's subjective. No, it's different from standard of living. Standard of living is subjective, it's objective, more objective, but quality of life is subjective. Yes. Now, these are constructs. Those constructs, in trying to assess the underlying construct, the extent to which the instrument tests the hypothesis of the theory it is measuring. Because some of these constructs, they come in theory. They believe that if somebody is happy, those are theory. It doesn't really mean that it will happen like that. But there is no better way. So there are two approaches, type of that. Dr. Abalaba, please, you are disturbing the class. Mute yourself. Yeah. So we have convergent and discriminant construct. Convergent construct and discriminant construct. So the convergence construct requires that the measure construct, which is the underlying variable, should be related to similar variable. Unless I give example, you may not understand. Why the other one should not be related to similar variable? Let me explain this discriminant first, maybe because it is easier for you to understand that than the convergence. For example, if you are saying you are measuring quality of life of people with HIV, the instrument, if to really validate that, is it actually measuring quality of life of people living with HIV? So you can do discriminant construct validity because the quality of life is a construct. So you can now, okay, this HIV people living, there are some people, they have developed AIDS. In fact, they are on admission. While some people, they have not, they just have HIV, they enjoy it, they don't even know. Nobody know that the person has HIV, is doing his own, he's living with HIV. In fact, some people even say they thank God they have HIV because through the HIV also they have gotten some job as counselor, counseling other people traveling around the world. And giving them opportunity. Some of them think that they may not even have if they didn't have HIV. So you have two groups of people now. People that have HIV, they have developed AIDS. While people, and some of them are on admission, and we have people with HIV that they look normal. So if you want to if actually that particular instrument is measuring quality of life of people with HIV, if you administer it, there should be a discriminant as per the people. You should not, the people that have the HIV and the AIDS, they should score differently from people. The average score, the people that have AIDS should be lower or than the other one. That's, you're able to discriminate. And if you have similar people, so maybe they are in different location, and they have this HIV, and let's for example, people that are the one that developed it, maybe in Ghana and in Nigeria, you administer it to them. It should correlate. That is convergent. That is, they have the same thing, and you administer the value, you're able, the instrument is able to know the results are not too different. since it's the same settings. So that is convergent construct. But whereas the one that differentiates between the two of them, the one that have HIV and AIDS and you that just living with HIV without AIDS, if the instrument is able to discriminate between them, the result should be different when you calculate the average value. That is discriminant construct. So I think with that, you'll be able to understand. If you look at it, the construct, though there's another third one people propose. Is it nomographic, they call it? You know, is it mono? I remember, I think the name appears somewhere here. So sometimes when they compare construct with construct, there are some situations, it's just like you are talking of anxiety. Okay, if somebody is having anxiety, is likely to have depression. Both anxiety and depression, they are construct. Both anxiety and depression, they are construct. So because the anxiety is some things, you cannot see anxiety physically, but it's the manifestation, what people think are the manifestation of anxiety you can see. So when you are trying to look at anxiety, depression, and some other thing, all of them are construct. So you are validating one with comparing one with the other. Since anxiety, they believe that people with anxiety may develop depression. So if the instrument is able to maybe, if you administer to people that have depression and anxiety, they are going the same way. It's a form of construct validity also. Now, let's look at this, just a picture, just to reinforce what I've discussed about criterion validity. Yes, we say criterion is either concurrent or predictive. Look at for concurrent validity now. If Webster IQ test of intelligence, the gold standard, Victoria's super duper intelligence test, give both tests and correlate the result. If you do it, you correlate, you'll be able to, if these things, Victoria super duper intelligence is measuring intelligence, just like the way this other one, the gold standard is measuring. If you give to the same people, their score should be close. Anybody that score high here should score high here. Anybody that score average here should score average here. Anybody that score very low here should score very low here. That's what it means. So it will correlate. We do the correlation. It depends on how they score. You can either use Spearman or Pearson correlation. We have discussed correlation. You see now, what we are doing now is more like applied, because when you talk about correlation, we have discussed correlation. So you won't be asked, how do you do that correlation? That one we have lectures on that, and you can subscribe and get the lecture. The video is there and the materials are there. Then look at predictive validity. College entrance test score, first year college grade in point. Can you see? So the predictor variable is this one. You are validating the criterion is the grade now. What you are validating is the predictor variable, college entrance test score. So these people, by the time you do the test score, the people that score high, are they the one that later have higher grade? But many exams in Nigeria is not like that because of corruption and I remember, hi, who is that? Let me try to, I can mute. I don't know why people, okay, the person has stopped making noise. Okay, let's just quickly finish up and entertain question. Somebody has chatted. I don't know if it's a question. Let's quickly finish up. So I think we have discussed that, criterion and predictive. So let's quickly look at reliability. Dr. Alabama Abalaba, you keep on disturbing the class. Anybody disturb, I will just remove the person. Please mute yourself where you are, because the noise that is coming out is affecting everybody. Yes, let's quickly look at the reliability now. Now, this slide just give a pictorial view. Reliability is the consistency of data streaming from a method. Consistency, that is how consistent, that if I do it, if I repeat it. Some people call it different in precision, repeatability. That is, if it's repeatable, if you repeat it, we will get the same thing. So if you look at it now, you'll see different contexts, which you can call types of reliability here now. Look at those yellow flow from the central. You see test retest. Each of them is applicable in a particular context, because you don't have the same context. Like for example now, in a situation where you just want to see if an instrument is one instrument, if I apply it now and come back and apply it, and if I want to see that is it reliable, that is it consistent, what I would do, or what I can call even the commonest method you can actually do, especially for an instrument, is test retest. You test, you administer the instrument to a set of people, and now wait for some time. That time is long enough for the people to have forgotten what the response they give you for each question. There is short enough for that particular attribute you are measuring for you not to have changed that person. For example, now, if you are doing quality of life, that was what I did in my project, part 2, quality of life. I did test retest reliability with a 1 WHO instrument. So I selected about 30 people, 30. We administered the instrument to them, make sure they note their name and addresses. So after 2 weeks, we went back to apply the test. That 2 weeks, if you go back, you bring that same question to that person, he's not likely to have remembered what he answered, what it is, because the instrument is on a Likert scale of 1 to 5. So the option is took in each of them. The person will know for all these questions, he will not be able to remember. At least he will just answer you naturally what he thinks. So the time is long enough for him to have forgotten. But the 2 weeks also is short enough for the quality of life of that person to have changed. Because if it's too long, that particular attribute might have changed. What you mentioned before may be different from what I'm measuring now. So can you see in test retest, the time interval between the test and retest should be long enough for the person to have forgotten the responses he gave before, and short enough for the attribute to have changed in that person. So when you correlate the two results, because it is for the same people, if the same 30 people, you enter it parallel, and you correlate it. Correlation, once the correlation is high, above 0.7 or 0.8, the high correlation means that, oh, it is reliable. And you say, okay, anyway, there's a table that shows that scoring agreement. In this case, you ask me, agreement are related. Yes, agreement has something to do with reliability, but agreement is being employed in reliability. It's a different thing entirely. Of course, in some context, it is actually the agreement you are using in reliability. Now, in a situation where you need to rate, you score. If you look at the test retest now, is the instrument, probably what you are looking at is the person your participant, apart from answering your question, has no role to the role is to answer the question. The person that is asking the question, the investigator, is to ask the question. He is not doing any scoring and that. He just to ask the question and be ticking. But in a situation where the person that is taking the measurement may have to do some scoring, like when you are doing finger clubbing now. If you want to assess finger clubbing, they have already given what do I call it, some guideline. If it is this, is this. If it is this, what? If it is this to grade 1, grade 2, grade 3. So the issue there is that if there's a possibility if I do it, another person do it, you may not score the same thing for the same person. Because you are rating. When you say rating, it's not talking about the effort, the judgment of the investigator has come in. The person that is collecting the data, the judgment has come in rating. So that's why we now, is there any agreement that even if I rate some people now, I come back to rate them, will I be rating the same thing? Or if I rate some people, another person rates them also. So that is why we will now have the inter-rater and infra-rater. So you do, everybody give you scoring. The inter-rater means you look at the rating by two different people. You see, they correlate very well. Intra-rater means the same person. You rate some people, you come back to rate them again. Are you consistent? Do you get the same thing? How do they correlate with your finding, the agreement? So that is agreement scoring. Then we also have equivalent or parallel or alternate form. You know, this one is when we have two or more instruments doing the same thing. Example that usually comes to my mind is that this RODT for rapid diagnostic test for malaria. You know, we have histidine protein and lactate dehydrogenase 1, the enzyme. So you see that we have two different types. People they bring they are actually doing the same thing. If you want to validate, because sometimes they will just give it, oh, it's RODT positive. Sometimes they supply some people with the histidine, the protein, some lactate dehydrogenase. So the two, are they actually doing it? You are validating. That's a parallel form. So what you do now, you will administer the two, these two instruments, the two methods to the same people and get. Sometimes also you can see even administer and see have a gold standard, like for malaria now, you may say microscopy is the gold standard. You can have the two RDT and apply it, the same set of people, you collect blood, you do microscopy, you use RDT with histidine protein, you use RDT with lactate dehydrogenase. You want to see the two of them, are they measuring the same thing? That is parallel form. It can be instrument also. It can be, there are many instruments to measure this quality of life. So the two instruments you may want to see, okay, are they, you want to validate them, are they measuring the same? That is equivalent or parallel alternative form. So internal consistency, if you remember, when we talk about the phase validity the other time, we talk about phase and content. The phase validity, the person was trying to see this instrument, are they pointing to the same thing? So that is what really in internal consistency and reliability doing the same thing. Because you can have a lot of questions in a particular tool or instrument. Are they consistent? Because if they are consistent, if somebody score high in one, the person should score high in the other. If somebody scored medium in one, he should score medium in another. If all of them are saying the same thing, if somebody score high in one, he should score high in another. If it's not like that, that shows that instrument is not pointing towards the same thing. So that is the internal consistency of that instrument. That is the item that make that instrument. Are they consistent in measuring that particular thing? Are they pointing to the same thing? And there are different methods people have come up with a split half, Kuda Richardson and Kronbach. So when you hear of Kronbach half coefficient, so this is where it's for internal consistency. So I think, okay, let's move before we close. I just want to, if you remember for validity, you don't have one coefficient. You just, okay, you can just do correlation. But here, there's what we call reliability coefficient. The reliability coefficient is an absolute number that can reach from 0 to 1. It's like correlation. It's actually like a better, it's not correlation because the correlation can be minus. The reliability cannot be minus. So this one is from 0 to 1. A value of 1 indicates perfect consistency. A value of 0 indicates a complete lack of consistency. So score assigned to the test taker by a completely random process will have a reliability coefficient very close to 0. The reliability coefficient is actually a correlation, but it doesn't have the negative aspect of correlation. So type of reliability, which I've explained on the diagram, but to really see how you actually do them. Test retest, I've said it, you administer the same test, measure at the 2 different times to the same group of people and correlate the result. Parallel form, administer the 2 different forms of same test to the same group of participants. You correlate the coefficient. You do correlation. A measure of agreement. This one is inter-rater and intra-rater. So we have kappa. Kappa, the way you measure this one is why you will not do correlation directly, because the other one you are doing correlation, you have already have score for them. But this one is rating, not score, is rating. So you may say that, yeah, if you do rating, why can't you use Spearman? But current kappa came with a method which we are not discussing, that maybe later we'll, in detail, how kappa, but for those that are coming for the workshop, we talk about how kappa did that, and how you solve it with, how you run it with computer also, how if I erase something, another person rates, how do we agree? Or if I erase something 2 times, how do we agree? Then a measure of how consistency each item measure the same underlying constant, which is internal consistency. So the commonest one we use is Kumba alpha. And the reason is very simple. The split up is an example. You have different examples. Like for split up, what they do is to divide. If they have 20 instruments, you just at random, you select 10 out and select 10 to the other side. You now see the score on those. You have the 10 out of the half of the questionnaire. You sum the score together. The other half sum the score. You correlate. They should correlate, because I've already said that if somebody score I1, if all of them are pointing to the same thing, the person that score I1 should score high in others. So believing that if you take half of it, correlate with the half of the issue, the correlation should be high if there's high internal consistency. But the problem with that is that there are different ways you can split something to half. Because if you put half here, you put, like we have 20 questions, you put 10 here, put 10 here. If you change the 10, maybe you one member of this one, you meet with, there are different ways you can select 10, you can differentiate. It can be your own 10, maybe question 1 to 10, or question, and then the other one will be question 11 to 20, or it may be question 1, 3, 4, 5, 6, 1, 3, 5, 7, even number and odd number, or it may be just by random. So that different way you can bring something to have. So it may give you different results. So that was how Kronbach. Now, what he did was to select one and correlate with the rest, each of them one by one, correlating with the rest, and now find the average. That's what Kronbach did. And I think we stop here. We can take questions, and let's stop here. I have some charts here. These are what does precision mean and what is the relationship between sample size and precision. That one, you know, the question, well, people ask questions that concern them anyway. Maybe they have expectations they are coming. Yes, the somehow precision also related to reliability, because if something is, but it's not exactly. What it mean because I know where the person is coming from. Okay, let me just explain it so that I won't say that I just push it aside, because I will advise the person also to subscribe to our this thing. We are talking about sample size. In fact, we have 4 videos on sample size for lecture. For 3 weeks, we're discussing per sample size, this issue of precision. Precision means how close, how accurate your measurement. Because when you take sample, when you summarize your sample, what you summarize is statistics. But in the population, the real thing is parameter. For example, now, if you try to calculate hemoglobin concentration, the mean hemoglobin concentration in the population, thousands of people, is the parameter, the average hemoglobin concentration. But you don't study the whole community. You take sample and you measure their hemoglobin concentration and calculate the mean. The mean in your sample is a statistic. That statistic is an estimate of the parameter. Now, you want your statistic to be as close to the parameter. The more your statistic is close to the parameter, the more precise your measurement is. Because in as much that you didn't take the whole population, your statistic can never be equal to your parameter. But how close is it? How close is your statistic to the population parameter is your precision. So when that particular criterion in your sample size calculation that measure that, if you are dealing with descriptive study, one sample study is what they call D square, level of precision. But for you to actually understand it, that thing, the real name that will make it understand is a maximum error of estimate. Maximum error of estimate means that you don't want to, the error means that the deviation from the parameter, because your statistic, when your sample will give you a value, but that value is not equal to the parameter. But the difference between your value and the parameter of the population is the error. So you don't want your error to be more than a certain percentage. That was a maximum error of estimate, because your statistic is an estimate of the parameter. So that one is what you call, they now call level of precision. If your maximum error is very small, you usually use 5%. If you reduce to 2%, you are more precise. Because if you look at it, form the denominator for your sample size. So it will jack up if your denominator is very small, the sample size will jack up. So when your level of precision is high, it will increase your sample size. And what makes your level of precision to be high is to reduce that maximum error. So you can see now. So it's better you call it maximum error of estimate, because the value, if you reduce it from 5 to 2, it is more precise and it will jack up your sample size. But if you increase it, it will lower your sample size. When you increase your denominator, it will lower your finding will be smaller. To lower your sample size, it's less precise. I think that's what. So the best you go and watch our video. Then somebody say, thank you very much. Please, sir, in two that end up with score that categorize people as mild, moderate, and severe, without them be a discriminant validity. Please, can you explain the equivalent for? Please, can you explain the internal consistency again? Thank you, sir. Well, you say the two, it depends on what you want to do. You now say is that form, you say thank you, the two that end up with scoring that categorize people as my model and without them be a no. You see, this thing is not as if maybe you not say, oh, is this one discriminant? Not you make itself discriminant. It's you that make things discriminant. It's you understanding. If you look at it, most of the time they use correlation. It's not only correlation you can use, but correlation, because when you know what you want to do, the best way is to correlate. Like when I did discriminant validity for the one I told you, the HIV, what I use, the mean I use, because when I calculate we do the scoring, the sum of the score for the quality of life. The people that are HIV positive and people that are not, the HIV positive are that hate patient that have AIDS, and just other people. When I compare, I discovered that this quality of life is lower, far, far lower with people that have age. It's higher among the other one. So that shows that it's actually measuring, is a confirmation that it's measuring their quality of life, because quality of life is a construct. It's not something that is objective, it's subjective. So the best way is just to do that, to say, okay, if it's actually doing that, people that are in real distress, they are on admission, they should not have, they should have lower score than the people that are just jumping around, but they know that they have HIV. So that they only come to the clinic to collect their, their drug, and maybe they have minor complaint and they attend to them. So what I did was to compare the mean and do t-test, and I see that there was a significant difference. So I've discriminated between the two. If there are two set of people that are held on admission on different locations, I don't expect any difference in the mean value. If there's a difference, that will be a problem. So if I did it, there is no difference. That is a convergent construct validity. And validity, okay, they are the same set of people, the same condition, and now they are having, there's no difference in their scoring. So you may ask me, what if it is a categorical thing? Because that particular thing you are mentioning may be categorical, just like what you have said now. If that particular thing you put in on a scale of mild, moderate, and severe, it's just for me to comfortably, if I'm doing discriminant, the two group that should be different in the two categories, the scoring on the two sides. But if there is no, if it is convergent, if there is no discriminant, or if it is convergent, there should not be any difference. That's just it. So what you now do, whether you do t-test or whatever, it depends on the type of variable you are measuring, the outcome variable of interest. Now, equivalent form just means that the two instruments are the same. Yeah, I give an example. You can have, they say, all these psychometric instruments and even quality of life. We have many instruments that measure quality of life. They say, oh, quality of life for TB patient. We have many of them. If you want to say, okay, these two, this one by Rutherford, this one by Olabode, are they doing the same thing? Okay, let's validate. You want to validate this. That is because they are the same. They claim to be the same. Are they doing the same thing? So you try to see if the score correlates. That is equivalent form. I give an example of the RDT. Of course, for RDT, you are not going to do correlation because the RDT will give you the outcome is categorical, positive or negative. So for the RDT, when you compare them, they should not give you different. You do the chi-square, they should not give you significant difference. Or even when you do their sensitivity, if you use like a validity, another gold standard, you compare their sensitivity and specificity is the same. So some people have a test that compare sensitivity and specificity. Then internal consistency. What I mean by internal consistency is that in a particular instrument, when we say instrument, we're talking of tool or questionnaire now. Let's call it questionnaire. They say 26 item questionnaire, 20 item questionnaire, 10 item questionnaire. That questionnaire, what did they measure? There's one questionnaire somebody is working on. He says measuring ankle, PAD. I've forgotten what they call it. Something ankle, something. So they are trying to measure, okay, clinical arteria, something. Yes, I think it's arterial disease, peripheral arterial, yes, PAD, peripheral arterial disease. You have some question. You have intermittent claudication. You have this thing, this one. And by the time they saw me, they say, they just say this person have PAD or not. So that about question, you may want to say, okay, all these questions, the list that is measuring PAD, are they pointing? Are they pointing towards this? If you score them, if somebody score high in one and score low in another one, and so on, that shows that they are not pointing to the same thing. Because it's somebody that have that arterial disease, it should, if increase in the value mean more arterial disease. The people that have arterial disease, all of them should have scored very, very high in all the questions. Not that you will score high in one and score low in one. No. They should be saying the same thing. That is talking about internal consistency. If you have an instrument that is measuring quality of life, if you have 20 questions there, if I score high in one, I should score relatively high. It may not be the same thing, but relatively high in others. Because if all of them is actually measuring the same, not that you score high in one, score medium and now, score low now, and it's like that for almost everybody. It's not, there's no consistency. There is no internal consistency there. You know, the score is not exam. You are talking, it's not exam. It's what really happened to somebody. It's not the exam now. You talk about the knowledge. You may, because for the fact that you know one aspect of the subject may not mean if you didn't do well, you didn't read the other one, you were not in class or whatever, you may not know the other side. We know that. But this one is not testing knowledge. It's testing what is happening to somebody. So if somebody score high in one, should be able to score high in other. If somebody score moderately in one, should score moderately in other. If somebody score very low in one, should score very low average in other. That is the meaning of internal consistency. It shows that those questions, they are pointing towards the same thing. I don't know if I have answered this basic question. Okay, wow, I understand. Okay, I understand that. Okay, another one. Yeah. Okay. Somebody has, is it possible to know the reliability combat alpha of a KAP study? With the score for the knowledge be different from the score of the attitude and different? You know, KAP, you have already said it now. KAP, even when is the name that is just bring them together. When you are doing the studies, knowledge is different from attitude and different from practice. So what we are talking about, the knowledge should be pointing towards the same thing. But well, to be sincere with you in that one, I don't think knowledge will be different. Attitude, yes. Attitude is for knowledge. You know, you have said somebody may, knowledge is a function of what you are exposed to and what you determine or whatever. So it may be difficult to use it for knowledge, but for attitude, yes. Because somehow your attitude is your attitude. All those questions, if they are actually testing attitude, they should be pointing towards the same thing, that person's attitude. But knowledge, somebody may know something, he may not know the other one. If you remember, for most of the knowledge question, it's either yes or no or other. But for attitude, it's more like a like SK. No, because it's difficult to pinpoint. Attitude is not yes or no. It's better put on a gradient. And most of these instruments also, that's what they put on a gradient. So knowledge owner, if answer is yes or no, you cannot say somebody, how will you know somebody score high one? Because it's all unknown. If almost all the questions are yes or no, how do you know one somebody, in fact, is yes or no, or maybe one correct answer in the others, even if they have more than two options. So knowledge does not come in here. But attitude, yes. Attitude. Practice also will not come in, it's attitude. So most of the attitude work with that. It's more like a psychometry instrument. So attitude. If somebody have a particular attitude, and if those questions are actually pointing towards particular thing, if somebody score high, one should score high in many of them. If it's very scored low, because the attitude of the person is the attitude of that person at time. Okay. Okay. Any other one? Any other concern? You can ask your question physically, because I've been reading the chat. Any question you want to ask, you can unmute yourself and ask the question. No more question. Okay. It's well understood. Okay. If that's the case, we can, let me stop recording.